Vad roligt att just du har valt att lyssna på vår podd. Tillsammans kan vi skapa större möjligheter för förståelsen för integrativ medicin och hälsa. Är du intresserad av det så bli gärna medlem i vår förening och en del av vårt nätverk. Mer information om det här kommer i slutet av avsnittet, men du kan också redan nu hitta det på vår webbsida integrativ-medicin.se. Jag som leder samtalen heter Lena Källqvist. Jag är ordförande för föreningen som driver den här podden. Min yrkestitel är legitimerad psykoterapeut med grundutbildning legitimerad sjuksköterska. We are recording at the Integrative Medicine Mental Health Congress in Washington, and by my side I have MD Cecilia Tibell, and our guest today is Professor Robert Lustig. Welcome.
Thanks.
I would just say before we start that we are in a room next to, or a lounge next to the Congress, so maybe someone will come in or we have some noise that will kind of interrupt us. So if the one who is listening knows that, and we will try to handle it during our conversations. So we are so happy to have you as a guest and honored that you give us the time to be our guest to this podcast. And I will hand over this conversation mainly to Cecilia Tibell, but I will be kind of the sidekick here. So,
Fly
Cecilia.
on the wall.
Yeah.
So flying on the wall.
Let's start with introducing you, because you're a professor at the University of California in San Francisco.
Correct.
And trained to be a pediatric endocrinologist. In that way we are colleagues, because I'm also an endocrinologist. And you have spent a lot of time doing research on the effects of sugar of the brain as well as obesity, and have started up a weight management program that you direct at the University of California, San Francisco. Yes. As well as founding and being a president of a non-profit organization focusing on nutrition.
Well, specifically to get real food into kindergarten through 12th grade in public schools in the United States. One of the biggest problems we have in the U.S. is that we are poisoning our children, and we're poisoning them in school, because ultra-processed food is not food, it is poison. And we can prove it. We see kids do better in school in terms of grades. We see them do better in terms of behavior. We see them do better in terms of cognition. We see them do better in terms of metabolic parameters, like, for instance, fasting insulin, when we feed them properly in school. Now, obviously, school is only 8 hours a day. They still go home, but they learn in school what they should be eating, and then they can be the positive disruptive force at home for their parents as well.
Yes, and I think actually James Oliver, the chef in UK, did a project which was criticized by people saying that your kids can afford to go whatever school and eat well. But he said, I was focusing on trying to change the British schools.
Indeed.
I can choose. Yes, that's true. I can affect whatever my kids are eating, but the rest of the population can't. And for this reason, I want people to understand what food is. And it's not chicken nuggets.
Well, people ask me all the time, how do you change, how do you turn an aircraft carrier around? Mm-hmm. How do you, change the zeitgeist of the, of various societal problems? And the answer is it takes a long time. But ultimately, it starts with the children. In the United States, in the last 30 years, we have seen four cultural tectonic shifts in America. And here they are. Number one, bicycle helmets and seatbelts. Number two, smoking in public places. Number three, drunk driving. Number four, condoms in bathrooms. Now, 30 years ago, if a legislator had stood up in a state house or in Congress or in Parliament or in the Duma or anywhere else and proposed any of those legislation attempts, they'd have gotten laughed right out of town. Nanny state, you have that in Sweden too. Liberty interest, get out of my kitchen, get out of my bathroom, get out of my car. Today, all of those are facts of life. No one is belly aching about any of those things. Oh, we have new things to bellyache about, like vaccines, but those four are settled. Okay? So the question is, how did it happen, and why did it take 30 years? And the answer is, we taught the children grew up, and they voted, and the naysayers are dead. Okay, that's why it is a generational shift. The point is, you have to start somewhere, and you start with the children, and you start by teaching them what food is. So here's a question for you, Cecilia.
Yes.
What is the definition of food?
Yeah, well, for me, I'd say food is the things you can buy in your supermarket that doesn't have an ingredient list.
That is not the definition.
No, but I mean, it's when people say, "So what do I eat?" I always say, "Well, if you start choosing the things that don't have an ingredient list, where you can go, this is a tomato, this is a piece of meat, this is a piece of cod or whatever," you start at that point and then look at whatever you put on your plate, and maybe not pasta, and maybe not that much potatoes, and definitely not crisps, and so on.
Well, those are the outcomes of the definition, but they are not actually the definition. The definition of food, if you go to the dictionary, and I did,
good.
is the following: substrate that contributes to either the growth or burning of an organism. That is food. So the question is ultra-processed food food?
No.
Because that's what we're giving our children.
No, it's not.
67% of all of the food that children in America eat today is ultra-processed. Is it food?
No.
And the answer is, well, does it contribute to burning? And the answer is that the fructose molecule in sugar, which is basically the marker of ultra-processed food, inhibits 3 separate enzymes involved in normal mitochondrial ATP generation. It inhibits AMP kinase, the fuel gauge on the liver cell. It inhibits ACAD-L, acyl-CoA dehydrogenase long chain, necessary for fatty acid beta oxidation. And it inhibits CPT1, carnitine palmitoyl transferase 1, which is the shuttle mechanism for getting the fatty acids into the mitochondria for burning in the first place. So in fact, sugar, and thereby by extension, ultra-processed food, actually inhibits burning. Okay, what about growth? My colleague, Dr. Efrat Monsenigo-Ornan at Hebrew University, Jerusalem, has actually looked at this question, and it turns out that ultra-processed food actually inhibits growth. It inhibits skeletal growth, trabecular bone growth, cortical bone growth, cancellous bone growth. It actually hijacks growth because cancers prefer it and can actually utilize it when other organs cannot. So if you're inhibiting growth and you're inhibiting burning, are you a food? And the answer is no. Well, and if you're inhibiting them, then obviously you are a toxin. So in fact, ultra-processed food is not food, it is a toxin. And so what I am trying to do is I'm trying to get, number one, doctors to understand this, number two, the public to understand this, and most importantly, I'm trying to get the food industry and politicians to understand this. As you can imagine, it is a very heavy lift.
It's a very
heavy
lift.
And you are a pioneer in this field. As you're, I heard you the first time that I told you in 2010 in Malaysia, and I've been working with obesity also in Sweden. And as you say very often, and people are professionals of dieting in this, but they're dieting on the wrong things.
Exactly.
They don't eat until 4 o'clock in the afternoon, but then they do baklava and orange juice and everything that you shouldn't do, that is actually worsening the problem. And all they do is put themselves in a hypercortisol state with adding the inflammatory markers of, and
You can't solve a problem if you don't know what the problem is.
No.
And we have been barking up the wrong tree for the past 50 years because the overwhelming majority of clinicians to this day still believe that fat is the problem.
Yeah, and interestingly enough, I think in the 50s, that what they used to recommend the type 2 diabetics was to eat a low-carb, high-protein.
Well, they actually suggested that sugar was good for diabetics because it didn't raise the blood glucose. That's right, it doesn't. It raises the blood fructose, which is 7 times worse, generates 7 times the reactive oxygen species, and actually causes more oxidative stress, oxidative damage. In addition, dietary advanced glycation end products bind to the receptor for AGEs called RAGE, generating more reactive oxygen species, and that's why everyone today has fatty liver disease.
Yes, and that was the lecture, and I'm going to recommend here for anyone who hasn't listened to this lecture. You can find it on YouTube. It's TED Talk. It's about 90 minutes long, and it's brilliant.
Oh, the original one?
Yeah,
it's called Sugar the Bitter Truth.
Yes.
It's 15 years old, but everything in it's still correct.
Yeah, it's still correct, and when I listened to it, because this was a Malaysian conference, and you're a bit jet-lagged, I just felt, boosted. I'm like, finally, someone's putting the truth on the table, and finally, someone is also connecting the dots and realizing the problem with this high-carb, low-fat idea of how eating, where we end up eating a lot of crap.
Well,
basically.
Cecilia, that was first televised on YouTube in 2009. It is now 2024.
And it's
still a problem.
It's still a problem. And we have actually a professor that called Ingmar Ehrenberg. Have you heard of him?
No.
He's a professor. He's a specialist in cancer in Sweden. And he made a replicat. I don't know how to say that in English, but he replicated Nobel Prizes from Dr. Warburg in Sweden. And they found out that sugar is driving the cancer molecule.
Yeah,
cancer.
And he did it in Karolinska Institutet, next to where we are treating the worst cancer sorts in Radiumhemmet, and they are still doesn't take anything of his research into. It's a kind of 20 meters between the houses.
Think of it this way: pancreatic cancers are going up markedly, and one of the reasons is because of insulin resistance driving pancreatic cancer. Well, it turns out pancreatic cancers have a specialized enzyme. They have an enzyme that we don't have called transketolase. So they can actually use the fructose molecule exclusively for their own purposes. So when you give a cancer patient Ensure, which is a standard nutritional supplement in order to try to boost their calories, you are actually feeding the cancer.
Yeah. So not only that, because you're adding stabilizers, emulgations,
emulsifiers,
preservative. It's so processed. And I talked to my hospital where I used to work. Nowadays I run my own clinic, but I said, couldn't we just in the emergency ward look at serving proper food?
Well, this is a big problem.
Yeah, big problem, because of course, because we have the N-source and similar supplementing food that you drink. You don't chew it, which is a problem to start with, because we need chewing. It's like a brain signal and all that. But so that's one thing, but it's also the nutrition of it. It's just horrid. I'm reading, the ingredient list, and I'm like, why are we feeding our patients this? And in the cancer departments, they feed them rosehip soup, which is basically a sugar solution, and white toast.
One of the other speakers at this meeting is Dr. Asim Malhotra, who's an interventional cardiologist from the UK, and he actually generated an entire campaign in the UK about why the food trays of the patients were as awful as what you just described. The fact of the matter is, we are actually making our patients sick, and we're codifying it, and we're telling them that that's the right thing to eat. This is why doctors need to unlearn nutrition, if they ever knew it. If
I think
the
problem is they don't. I mean, we've had like 10 hours of training in nutrition.
We have less.
Yes, and I say, if you look at healthy people, they don't eat the food we serve in the hospital. And normally, if they're really healthy, they ask their relatives to come with the food so they don't have to eat the hospital food, which should say something.
Indeed.
But you have also, I think, because you have at least 3 books that we should know. I mean, the last one is Metabolic, and that is approaching this problem, right?
Yes, absolutely. So I've written 3 books. The first book was called Fat Chance, and Fat Chance basically argued the following. People say you are what you eat. That's not true. You are what you do with what you eat. You are what you metabolize. My second book was called The Hacking of the American Mind, which is about diet and mental health, very relevant to this conference that we're at, and will be sold actually tomorrow. The third book, most recent book, is called Metabolic, And the reason I had to write that book was when I wrote the first one, I said, you are what you do with what you eat. I got that wrong. Because in the intervening 8 years between the publication of the two books, I learned a lot about the dark underbelly of the food industry. I learned a lot about the subterfuge. I learned about the corporate determinants of health. I learned about how food companies and big pharma ultimately manipulate data and manipulate science in a way to basically, fuel the fire. And so I had to write Metabolical because it's really not you are what you metabolize, it's you are what they did with what you metabolize. So people need to understand that often when they're hearing, advertisements on TV for various foodstuffs or even for various drugs, it's not what you think. And the fact is, we need to make nutrition, mandatory training for every healthcare provider in any developed and developing country.
Right. I couldn't agree more because I really feel that this is lacking. And actually, when you talk to colleagues, they say, but patients are not motivated to change. And I'm saying you don't take the time to explain. You don't take the time to convince and make your patients understand what the problem is. You spend time with all these drugs that we then feed people, and most of the drugs are not really doing anything but putting a plaster on a problem that's still sort of boiling.
Well, there is another factor that we have not talked about, and that is the addiction factor. The fact is that sugar is addictive. Okay, if you were a cocaine addict, you wouldn't be offering people cocaine. Okay, if you were an alcoholic, you wouldn't want to work in a bar. Okay, the fact of the matter is our food supply is completely contaminated with sugar, very specifically because the food industry knows when they add it, you buy more. And we have the data, both physiologically and also economically, to demonstrate that. It's a phenomenon called price elasticity. When they add sugar to the food, it doesn't matter what it costs. You will purchase more. You will buy more. It's how they keep their money flowing. The point is that if you don't know you're addicted, how can you get off it? We have to explain to people what the food is actually doing to them so that they have a chance to be able to get off it. I will tell you that in my clinic, which was a lot of kids in lower socioeconomic status, okay, with parents who did not understand, we were able to help 50% of them lose weight because we explained both toxicity and addiction to both the patient and the parent together.
And then proving my point that if you take time, and I worked obesity, and I would say they are very motivated patients. Indeed. They really don't want their situation.
No one wants to be obese.
No, and if it was just, as I said, if it was just calorie in and out, then it would be an easy problem to solve. But it's not. It is exactly what's the nutrition. If you eat something that only contains sugar and nothing else, your body's still going to crave something because it wants once. It's going to get the rewarding effect. Nucleus accumbens going to light up because you feed sugar. So, and you would want that again, but also your body's going to still say, this was not something I want also something else, and then you're going to try. And then you're going to turn to the easiest, cheapest choice because obesity, at least in Sweden, hits especially the lower socioeconomic groups.
In Europe, there is a group of scientists that belong to a loose consortium known as Neurofast. They do not believe in food addiction. They believe in eating addiction. Whereas in the United States, we do believe in food addiction. We just had a consensus conference in London in May of this year to basically codify the concepts of food addiction, and ultimately settled on ultra-processed food addiction. And we are now trying to get the WHO and the DSM and the American Psychiatric Association to codify those as entities so that we can get insurance services to pay for rehabilitation. So this is a very, shall we say, contentious, but nonetheless extraordinarily important aspect of trying to turn this metabolic debacle around.
Yes, because we are getting fatter, and we have type 2 diabetes, and we are inflamed, and we get cardiovascular disease.
And what we're doing currently is clearly not working.
Yes, I completely agreeing, and this was that's when we came here. I said we really need to try to talk to Robert.
Einstein's theory of insanity is doing the same thing over and over again and expecting a different result. Well, for the last 50 years, we've been doing the same thing over and over again, and guess what?
Yeah, and I also found when you did that lecture, I remember you talking about one of the big problems was Nixon and the legislation saying that everyone needs to be able to afford food, and that put pressure on the food industry, and is partly also why the food industry went to, what can we do to make things taste sweet in the cheapest possible way?
And this is the equal and opposite reaction to that.
Yeah.
Right. I just wanted to say that because I saw a movie with Freud. Freud Last Session. Have you seen it? It came out for a year ago, and we saw it on the plane here. And Freud say to Anna Freud that Einstein said that if you do the main insanity is when you do all over and over again. Right. So and he also said that if you're intelligent, you learn by your mistakes.
Well, we're not very intelligent,
no, we are
are
not very intelligent. The human being are not so intelligent. Indeed. Could I ask you something? I sit here with two endocrinologists. Sorry. And we have this. We were starting up with speaking about mitochondria. And we have all this. Now we have post-COVID. We talked about it a little bit with Ayman and so on. And if we have ME, we have post-COVID, we have also
hypothyroidism.
Yeah. All those people with low energy. How can you have you something to say to all the healthcare medical people listening to this?
I don't want to talk about COVID at all because I am not an expert in it.
Of course.
And it is not something that I can speak from experience or from expertise. So that is not something I will address. In terms of what is going on in general, we know that mitochondria are not working as well as they used to. We know that. How do we know that? We know that because in the United States, at least, we have records of body temperature going back 150 years. And in fact, the mean body temperature of the United States has gone down by 1.5 degrees Fahrenheit in the last 150 years, from 98.6 to 97.0. And the question is, how can that be? Well, 40% of all of the energy that you produce is heat. So if you're generating less heat, that means you're generating less ATP in your mitochondria. So we have documentation of mitochondrial dysfunction. In addition, laboratory animals in captivity for the last 25 years, eating the same food as they always have, are continuing to gain weight just the same way we are, despite the fact that they are not eating ultra-processed food like ours. They are eating their own, pellets, but the recipe hasn't changed. So what that says is that there's some environmental insult that both we and those animals are also exposed to. So if we know that there's something external and we know that it's affecting body temperature, we know that we have mitochondrial dysfunction across the board. And we now have data to show that our mitochondria are not working as well as they used to. Well, I've already told you one reason for that. One reason is sugar, because of those 3 enzymes that are inhibited. Another reason is because mitochondria are made up of fats. Okay? The structure of mitochondria, the cristae of mitochondria, are fatty acids. Okay? And people have done studies to determine, well, if you have different combinations of the fats in the mitochondria, do they work as well? Are they as efficient or not as efficient? And it turns out that you need fats that have 2 double bonds. Basically, what you need is linolenic acid. Okay, that's like omega-3s, right? But that's not what we have. We have omega-6s. We actually have the wrong fats in our mitochondria, and they generate more reactive oxygen species. Therefore, they kill off mitochondria faster. We have more old and decrepit mitochondria, even at baseline, than we used to, probably accounting for why we have less body heat. So we have a mitochondrial debacle, and it comes externally, it comes internally. It comes from the food, it comes from the air, it comes from the water, it comes from the toxins in the environment, it comes from climate change. Everything that could go wrong with our mitochondria has. Oh, by ionizing radiation, which is a problem also in terms of the atmosphere. Okay. Everything has conspired against our mitochondria. And as long as that's the case, we will continue to have problems. Now, having said that, back of envelope calculation, I estimate, and I've talked with other people about this, probably 80% of that mitochondrial dysfunction is due to the food. Now, the other 20%, that's going to be really tough to deal with. Okay. But let's fix what we can fix. And the easiest thing to fix, because it was what the food industry specifically did for its own purposes, is sugar. That's where I think we start.
I agree, and I also think doing nothing is worse. And I mean, as for mitochondrial health, it's also the fact that we actually inherit our mother's mitochondria. Well, so if I have a lot of mitochondrial dysfunction, my kids are going to carry that. And then they add with whatever they eat and the environment. So we are sort of depleting the human race slowly but gradually and becoming not what we are supposed to be. Like I always say, that we used to be a Stone Age man living in a cold, moist cave in a heap of people going out, finding roots, meats and stuff. And
a lot of these insults are epigenetic. That is, they are carried transgenerationally. My colleague, Dr. Bruce Blumberg at the University of California, Irvine, has demonstrated using a specific obesogen called tributyl tin, something they paint on the bottoms of boats to keep the barnacles from attaching.
No doubt.
Turns out that tributyl tin is a specific mitochondrial toxin, and it is an epigenetic change that ultimately leads to dysfunction of an enzyme called insulin-degrading enzyme. Well, if you're making less insulin-degrading enzyme and it transmits from great-great-grandmother down to you, you are going to get fat because you can't get rid of your insulin as fast.
Could I ask you, it's just like this 80%, I saw that you were also at this lecture with Dr. Patrick Hanaway about the microbiome.
Yes.
And our microbiome has decreased with 80%, didn't he say so? Or
yes.
was it? Yeah. So it's very interesting with this isomorphy, with all this. But how do you think is this affecting each other?
I think 80% of it's the food, and Dr. Hanaway basically said the easiest way to fix your microbiome is fix the food.
Yeah.
Yeah, agreeing. Right. And I mean,
fix the food.
Right. We start early in life. For a while, we were told that we should, instead of breastfeeding, give our kids formula because it was more nutrition and it was containing sugars, gluten, everything insulting the system. So we start off with early in life not getting what we need.
Well, this is why doctors need to learn some nutrition.
Right. Do you have such education here?
Sorry?
You're out, you're writing books, you're lecturing.
I'm trying hard.
Yeah, you really do. And you're doing an amazing job. But are you having an education? Maybe you should have an education for doctors.
He has education.
So actually, if you go
as well. If you go on his site, you can see that he offers.
So we say that to everyone who listens to this, doctors especially. You can see.
Go to robertlustig.com, and there is plenty of information and also infographics for your office that you can basically provide to your patients.
Is it also? Is it just for doctors, or can I, as a nurse and a psychotherapist, also come?
Oh, no, it's all free.
Okay, good.
Yeah, so no, because I think going back to the mitochondria, because I think that's interesting. I work a lot with. I ended up with now in my private practice a lot of complex patients. I do a lot of post-COVID, MECFS, hypothyroidism, especially Hashimoto's, where it's still not known from doctors that Hashimoto's causes a problem. Even if you have normal thyroid levels, you can still be very sick. And then just thinking about the mitochondria, if you would want to just explore that a little bit.
It's a little complicated, but what I can say is that there are two hormones that come out of the thyroid gland, T4 and T3. But T4 is really a pro-hormone. It only has 5% of the activity of T3. T3 is really the active hormone. When you have Hashimoto's thyroiditis, your doctor gives you Synthroid. They give you T4. They don't give you T3. And then you have to convert the T4 to T3 within the cell. Well, there are a lot of things that can affect that enzyme. So sometimes giving T3 helps a little bit more. Depends on the patient. It's not an across the board. But there are a lot of patients where they have hypothyroidism, you put them on T4, and they just don't feel good until you actually add the T3.
Yeah.
And when you look at the T3 levels in those patients, they are very low. So there may be a problem in terms of the 5' monodeiodinase converting the T4 to the T3 at the target cell.
Yeah, and I think the problem is we can't measure intracellularly, but there's also some very interesting research coming on T2, where we for a long time has thought that this is not biologically active, but the last 10 years there's studies showing, and actually part of what T2 does is affecting the mitochondrial regulations of these enzymes.
I don't think we know that yet, but I've heard that. I think there's more data
I see so many patients, so I try to keep up. Also, they have just started to recognize another few metabolites that seems to actually affect the beta cell in pancreas.
I didn't know that.
No, I'll share. I can share. I have an article. It's really interesting. So I think we have totally underestimated the complexity. I think the problem is that doctors are trained to think that if we give T4, that solves the problem. It's an easy solution for the doctor, but it's, from my experience, a lot of patients come to see me and literally their hormone levels in the blood is fine, but they still have edema, they still have weight gain, they still have brain fog.
And they don't feel good. Right.
And they still feel down and so on. And
that's right.
And then once you change their medication, I always very often end up giving less hormones, but still they feel better.
If I have one piece of advice for the listeners, if somebody has a genetic disease, great. If somebody has an infectious disease, great. If somebody has symptoms that don't make sense, it's the mitochondria till proven otherwise.
Yeah, and I think the research is showing that more and more we are focusing on the fact that with the ME/CFS, it's like now a well-known fact that it has to do with mitochondrial dysfunction. And then people are arguing why, but that's a different story. And the same thing with post-COVID.
And the one thing to do is to fix the food and get out from the sugar.
Absolutely.
That's what Professor Dr.
Fix the food, stop the sugar. There are 3 things you should do to the food. Get rid of the sugar, add fiber. Sorry, 4 things. Let me start over.
4 things, yeah.
There are 4 things you need to do to the food. Get rid of the sugar, add fiber, add omega-3s, and get rid of emulsifiers. If you do that, then even ultra-processed food could be healthy.
Oh, right.
Yeah, and I also actually, because I follow you, shared a rather recent study on meat, because it's like on red meat, because it's been like red meat has been sort of, we are not supposed to eat meat, it's dangerous, it gives you cancer and so on. But the study you were sharing was actually showing that if you feed your animals the right food, they will not have the omega-3, omega-6 ratio that the stressed growth hormone treated cows do. And how you prepare the food is going to matter.
Well, all of the studies on meat and saying that meat's a problem all look at processed meat, not raw meat. Okay, not meat that you prepare, but rather that the food industry prepares. And there's a big difference between those. First of all, processed meat has all sorts of fillers and carbohydrates in order to hold the meat together so it doesn't fall apart. And those then develop dietary advanced glycation end products as well, especially under high heat. You get those rages that I talked about, the receptor for advanced glycosylation end products. Okay. In addition, we've learned that the red meat, okay, the iron can be an oxidative stress. It can. I'm not saying it can't. But it's not because of the saturated fat that you have the problem. It might be because of the iron. Poultry, does not do this because it doesn't have nearly the iron. The fact is that, we keep saying it's the fat in the food, and I don't believe that that's the case. I think that's a mistake. Rather, it's the carbohydrate that ends up causing the fat in your liver. That's the biggest problem, because the carbohydrate in your diet gets turned into fat in your liver through this process called de novo lipogenesis. And then it doesn't make it out. And now you've got it precipitated. Now you've got fatty liver disease. And now 45% of Americans have fatty liver disease. And I'm sure it's, increasing in Sweden as well.
Right. Yeah, unfortunately, I would have to agree. And it's also that what happens then in the liver that is inflamed. I mean, what happens with our detoxification, what happens with the de novo synthesis of other substrates.
And we know that we won't take too much time for you because you are doing a very important job here, here at the Congress.
I have a lot to do.
You have a lot to do. So before we stop, I just want to ask you if there's something else you want to put out to the Sweden listeners, if there's something more. You have given us so much already, and what to do if we have these mitochondria issues and so on and so forth.
You can't solve a problem if you don't know what the problem is.
Right.
And we've been barking up the wrong tree for a long time.
Right.
It's time to solve the real problem.
It's time to solve the real problem.
Yes, and I would say, what would you say to our healthcare practitioners, the doctors out there?
What would I say? I'd say go back to medical school. No, but not the medical school you started with. We need education of doctors outside of the standard medical practice. Now, in America, I don't know about Sweden, in America, 80% of all medical education is underwritten by big pharma. This is a terrible conflict of interest, and I wouldn't be surprised if the same were true in Sweden as well.
I think
it's certainly true in Denmark.
I would say it gets worse, because nowadays, if you look at Karolinska Institute, where I was trained, for example, a lot of these industries are sort of living just close by.
Indeed.
And we let the big pharmaceutical companies do the studies. I mean, it used to be that once upon a time we had a state-based research, and the pharmaceutical companies could, of course, take benefit from the studies that were made. But nowadays, most studies that we do are RCT studies on some kind of drug. And of course, you can do a lot with statistics, and you can show things that you want to.
Come to the film tonight. You will enjoy it.
Yeah, we are coming.
I saw that. I heard. We had actually. There's something called the Doctors' Revolution in Sweden, where they started like an uproar against the COVID vaccine, and so Asim has been an advocate in the UK, and I heard him lecture, and I wish that we can get a chance to talk to him too, because he's brilliant.
He will be here soon.
So we will do that.
And we will enjoy the Q&A tonight after the movie as well.
Very good.
So,
Professor Robert Lustig,
thank you for having me.
Thank you so much
And Cecilia.
to guest us, and we keep in touch. Maybe we will have you in Sweden.
Look
in a
forward to
conference.
see you in Stockholm.
Yeah, we do. And thank you,
Very
Cecilia Tebell.
Thank you.
Okay.
Både och istället för antingen eller, en podd om integrativ medicin och hälsa är skapad och drivs av Svensk förening för integrativ medicin och hälsa, FIM. FIM är ursprungligen en yrkesförening för legitimerad vårdpersonal. Vi representerar sjuksköterskor, dietister, fysioterapeuter, läkare, psykoterapeuter, psykologer, tandläkare för att nämna några. Idag omfattas våra medlemmar även av associerade medlemmar som inte behöver vara legitimerade. Föreningens arbete vilar mot en vetenskaplig grund för integrativ medicin och hälsa, såväl svensk som internationell och på systemisk förståelse för människan i sin miljö. Föreningens arbetssätt har hittills varit att arrangera konferenser, seminarier och folkbilda genom att sprida information, exempelvis via sociala medier. Vår strävan inom integrativ medicin och hälsa är att vara en organisation som vågar lyfta och ifrågasätta, motverka polariseringar genom tvärvetenskapliga dialoger och sokratiska samtalsregler. Vi vill kartlägga forskning som bedrivs även internationellt och hålla koll på forskningsresultat om behandlingsmetoder, både vad det gäller den etablerade vården liksom den vård som bedrivs utanför den etablerade vården. Sokratiska samtalsregler innefattas i den sokratiska samtalsformen som egentligen all grundläggande kunskap är sprungen ur, men som ibland till och med lyser med sin frånvaro inom public service. Så bli gärna medlem hos oss, för tillsammans kan vi förändra. Och hur du blir medlem hittar du via vår hemsida integrativ-medicin.se. Vi ses och hörs i nästa avsnitt.